Medicare and Medicaid programs have experienced significant changes in today's society. The initial objective for long-term care workers is to reduce the number of hours spent on tasks which are redundant and provide little to no benefit. The result of these changes is taught to design the patient care facilities with minimal cost, maximum time focused on patients, and overall improve the environment. Throughout the paper, it talks about the long tail theory, the problems that have been following the rule on the Medicare and Medicaid reform requirements for long-term care facilities published on October 2016. It talks about what public comments are and what the subtopics of general comments are. Also, subtopics of policies and regulations of administration. Lastly, how requirements for long-term care facilities relate to the long tail theory.
The final rule on the Medicare Medicaid program reform requirements for long-term care facilities, published on October 4, 2016, presents a number of problems for long-term care facilities, the majority of which place burdens on staff and have the potential for undermining the delivery of safe and high-quality care to patients. In response, the CMS proposed a new rule that is designed to remove requirements in the final rule that have been identified as unnecessary, obsolete, or excessively burdensome on long-term care facilities. Among the problems identified were the excessive burdens associated with new provisions concerning compliance and ethics. Every facility are required to have a compliance and ethics program. The new rule proposed would give long-term care facilities much greater flexibility in terms of enhancing their compliance and ethics program, as well as reducing the frequency at which those programs must be reviewed. Another problem area that has emerged from the final rule is associated with the provisions on food and nutrition services. This provision was found to create a substantial and unnecessary time and cost burden, especially for long-term care facilities that have limited flexibility as well as financial resources to replace nutrition and food services directors while they pursue certification with approved agencies. The newly proposed rule will allow food and nutrition directors with the minimum of 2 years of experience to continue with no need for certification, while all new hires to such position with no certification or experience required only to complete a minimum course in food and safety management. A third problem that the newly proposed rule addresses is the quality assurance program involvement. The final rule calls for the establishment and implementation of quality assurance programs for facilities that require improved reporting of activities suspected as crimes in long-term care facilities, as well as compliance with the newly enhanced definitions for the skilled nursing facility and definitions for nurse aide and resident representative, to name a few, but adding to performance requirements that are not imperative for every long-term care facility. The newly proposed rule would remove such requirements and all long-term care facilities greater flexibility in tailoring their quality assurance programs to meet the unique needs of their respective facilities.
Public comments are a component that is part of the federal agency regulation process. These comments are used to implement laws passed by Congress, which is achieved through rules and regulations. Public comments are important because it gives a chance to have concerns heard on regulations that can largely impact lives. These comments help regulators provide insight on how to improve their rules. The comments shine a light on how certain policies will impact an individual, show whether the rule is going in the right direction, improve rules that are already stated, and provide grounds to change bad ones from being finalized. There were over 9,800 public comments in response to the July 16, 2015 proposed rule, Medicare and Medicaid programs, reform of requirements for long-term care facilities. These comments were received from long-term care consumers, group that advocate for long-term care consumers, state survey agencies, legal organizations, organizations that represent providers of long-term care and senior services, long-term care ombudsman, various healthcare organizations, and many individual healthcare professionals. The public comments specifically regarding the reform request for long-term care facilities are very valuable because the residents of these facilities are some of the most vulnerable members of our society. These residents are also consumers of these facilities. They are living there and directly experiencing the effects of these regulations and are not always able to speak up for themselves. Public comments brought attention to the burden it would place on long-term care facilities, the cost of new provisions, and the language being used to define them. The need for changes, however, is overdue because long-term care has become more complex. Care given to residents no longer just focuses on medical need, but also social and mental health is essential to creating good quality of life. With these changes, the goal of achievement of patient-centered care. The public comments focused on many different topics, which have been classified into 5 themes: introduction, overview, rights and responsibilities, aspects of care, services provided, and policies and regulations. Introduction overview comments showed support for overall revisions to the requirements and felt that reforming the existing requirements was necessary in order to achieve high quality of care in long-term care facilities. This support was accompanied by continued focus of patient-centered care. The largest concern was surrounding implementation date, with not enough time to meet these new requirements. Other concerns brought attention to the proposed changes being too broad in scope, changes being burdensome, reduced public aid funding, and low staffing numbers in long-term care facilities, and the ability to meet new requirements. Overview and rights asked for residents to be made for provisions in relation to the respect and dignity of residents. This included residents gaining control over their rights, which included planning and implementing care, access to information, privacy and confidentiality, and room arrangements. Aspects of care comments in regard to transitions of care welcome improvement, but concerned that there was organization was confusing and required modification. Resident assessment showed support for revisions to more clearly defined assessment of each resident with a focus on strength, goals, preferences, and life history. Quality of care and quality of life expressed the need for training on the subject with a specific concentration on dementia. Services provided covered all services. Some main comments focused on the following: physician services engaged with support to revise the language, necessity of an in-person evaluation before an unscheduled hospital transfer. Nursing services leading spheres were surrounded around staffing issues, responsibilities, and competent skill levels. Comments also addressed the need for specific requirements and guidance concerning dementia patients. Pharmacy services had many apprehensions associated with psychotropic medications and the request of additional oversight with the goal of reduction. Food and nutrition services incorporated concerns of guidelines set forth for staff skills, credentials, hanging and storage, and requirements for food in relation to religion and culture. Policies and regulations is the last theme. Administrative comments back the requirement of facility assessment. Quality assurance and performance came with general overall encouragement with the QAPI, but suggestions for representative staff participation and disclosure of information. Infection control supported compliance with many proposals and having staff properly trained, including an infection prevention control officer. The effect of public comments on the final regulation allowed for revising definitions, consolidation and addition of provisions, removal of language, replacement of old terms with more modern ones, and clarification of terms and guidelines. These actions were performed with the goal of achieving a requirement that will improve residents' quality of life and care. Due to the gross amount of provisions and impact financially needed to move forward, an implementation timeframe has been established, which will take place 3 years from the effective date of the final rule. It will include 3 phases, which are based on how complex the revisions are and the time needed to interpret it and placed into rule. Public comments themes helped to provide insight on how the public felt regarding new provisions, and many changes did occur. However, grave concerns still exist around financial funds to support these changes. Crucial provisions did, however, occur. Some examples include now residents are able to sign their personal care plan, which allows for participation and review of the plan, responsible access and appropriate privacy to the use of electronic communications. Food and nutrition requirements shall also have a certified dietary manager. Establishment of a QAPI program. Infection control will also have at least one infection prevention officer. And compliance and ethics programs will also have to be established. Training for every member of staff will include education on infection control, QAPI program, communication, rights of residents, abuse and neglect, and dementia training. Facility-wide assessments will also now be required. All these provisions are expected to come with a cost of $831 million in the first year, with a decrease to $736 million on each year after.
The long tail phrase was first created by Chris Anderson in 2004, and it has the notion of idea that online retailers will continue to have greater profits online versus the physical retailers due to the amount of shelf life that physical retailers need in order to have more products for their production. As explained in the examples, a long tail theory has a demand curve, and the demand curve always goes a way, and it goes into like a flattened head curve that flattens towards the tail, and it causes the effect. The internet has an open door and unlimited resources for their providers. The use of the internet for online shopping has become more popular every day as vendors are providing more products that we are not seeing physically in our stores that we are now seeing provided online in unlimited quantities that provide unlimited consumers access to this product if they are available for purchase online. The long tail theory ties into the idea that internet online access is a lot easier than physical access for people that may also have like disabilities or no way to physically go get their products. Online has created an open space where consumers can sit in the comfort of their home and continue to shop online for a more convenient sake for them and their families. Online competitors don't face as much competition as physical competitors due to the lack and limit of quantity of items that physical competitors have in comparison to online competitors and vendors, which always have an limited amount of products that will provide for their consumers and continue to be more proficient and beneficial to their consumers than it would be to shop online or that it would be to shop physically in stores. Online retailers grow bigger and faster due to the abundance of shelf life that they establish, which saves them a little more money and provides more quantity, which equals more money for the online providers to continue to provide these goods and services to their consumers at less of a cost than a physical retailer that has to provide only so much quantity that their shelves will be able to take. Consumers become more selective when shopping online at physical stores due to low selection. The demand for certain items and goods are lower compared to online. When there is a wider variety and selection for consumers to choose from, they are more likely to have a higher demand for items and requests that will meet the online consumers. The online mass market has plenty room for employees and has plenty of room to hire for more position amongst sellers because of so many vendors that are online compared to physical stores where they are only limited to so many employees that are able to work in these physical stores and to help customers and provide customer service. Whereas online, there are customer service reps and there are different reps and representatives that are able to be taking place and employed to assist all customers worldwide online for any needs that they may have or any questions that they may have in regards to buying the consumer goods that they are selling. The theory that online consumers are able to employ more employees definitely depends on how good the online consumer is doing and how much profit the online consumer is making and able to generate in order to not only hire these employees and bring in more employees for these positions, but to also expand their consumer goods, which is making it possible to provide and pay for these employees. Versus in physical stores, you are only limited to so many employees due to pay cuts and payrolls that only allow employees to get paid a certain amount of money to stay within that company's range of income that they are able to receive. Reform of requirements for long-term care facilities relates to the long-term theory in the market because they both require strategic plans in order for both to be successful. One cannot just have a certain amount of goods and high selling goods if it's not in demand. You have to have an amount of high demand goods that are also selling, and you can continue to keep those demands and those goods provided to your consumers, which would be able to keep a company in better standing in the economy.
In short, there have been many changes in Medicare and Medicaid programs over the years. If there are more facilities, it would benefit the patient to get the help they deserve. The long tail theory all comes down to the quality of care provided to the patient. All of these topics are related to this class because long-term care is a big change in people's lives, and it is up to us to provide the best care we have to offer. I would expect to see large changes in variation in the distributions of patient insurance use. There are many factors that play a role in the requirements for long-term care, but if everyone works together, long-term care can come a long way.